Hello again to everyone. I just wanted to start the webinar now and to introduce the way that this will work for everyone on the call. For those of you who have not joined us on a webinar previously, what we will do is share a demonstration of the product and a presentation from MobileODT.
Yes, thank you very much, Brian, and thank you for having us on this webinar. And yes, it's really my honor to present MobileODT, and we hope that all of you are going to be able to work with us in some capacity. And if you have any questions, as Brian said, please feel free to ask, raise your hand, interrupt, and be in touch. So we're MobileODT. We're a medical device company based in Tel Aviv, Israel. And we have been working in over 20 countries around the world. And our first product is used for women's health for cervical cancer screening, specifically looking at low resource settings. And the reason we developed this technology is because we realize that there are many challenges with current methods for screening. There are many challenges with current technologies out there for cervical cancer screening. I'm sure many of you know that cervical cancer is the fourth most common cancer for women around the world, but really in low resource settings, it's generally the first or the second. And the most tragic thing about cervical cancer is that it can be prevented and can be treated if it's caught in the first 5 years. And the challenges for being able to address cervical cancer on scale have been the price of colposcopes, the shortage of expertise, and then of course the lack of data for decision makers when it comes to what information is available and how many women need to be screened, where they need to be screened, what really has an impact. So with this in mind, we decided to develop the EVA system, which stands for the Enhanced Visual Assessment System. We are an FDA and CE approved mobile colposcope. But what you'll notice is actually it's a much bigger solution than that. It's a lot more than a solution for colposcopy. It actually is an end-to-end solution that goes directly into the clinical workflow and addresses everything from capturing patient information to visualizing the patient with the colposcope, to being able to share images and information with an expert for remote consultation, for telemedicine, referring patients, capturing patient records, and then data warehousing. And all of this is possible with our EVA System solution. And as you can see here on this slide, the way it works is we have the small handheld or portable colposcope, which is battery powered. It's as powerful as your standard colposcope. It's about a tenth of the size, a tenth of the cost, but is infinitely smarter. It uses a mobile phone in order to create that integration into the health system that we were just discussing. So what you have with the hardware are these powerful optics, the equivalent to a Welsh Allen colposcope. You have a powerful light source that's battery powered with 12 hours of continuous battery, and that's rechargeable by micro USB, and then a cross polarizer between the light and the lens in order to reduce glare. And that's the colposcope. But with it, then comes in the mHealth tool, which is our software solution to really enhance the power of the colposcope. And so what you see on your left is our easy-to-use software. It's a mobile app that you can download on the Play Store. It comes on the phone. And you have a username for each one of the users, so a username and a password. That way, patient information is always stored very securely and is specific to the healthcare provider that has access to it. You're able to use that software to capture patient information, to visualize the cervix, to capture images, to annotate those images, and then everything that's captured on the mobile app automatically goes to our online service, which you can access from any computer, any iPad or tablet, and use that either for real-time visualization so that you can share those images with your patient, or you can use it also to manage patient information. So you can print the patient records, you can share it with peers, and then of course you have the statistics, which is where you're able to sort out all the different data, all on the same website. So now let me go into detail a little bit more. with the mobile app. Okay, so let's take a second just to look at the Colposcope. So you can see here, and I actually think maybe I'll turn on my video so you can get a better sense of the size and the scale of this. Is that all right, Brett? Okay, so you're looking at is a really small handheld mobile Colposcope with that light, the lens, and a cross polarizer. And you can see it's really, this is our demo device, small handheld, and it comes inside of this box. And you can take our EVA system with you anywhere. We have doctors taking it on boats, we can keep it in a clinic, really in any location. So you get a sense here of the size. But just because it's much smaller doesn't mean we're compromising on quality. So between the lens zoom and the digital zoom, we end up with 16 times magnification for really superior visualization. And again, that cross polarization for glare reduction, which is generally an issue for colposcopists that are applying some kind of acetic acid or iodine to the cervix, and you don't want to get that kind of glare. Now let's look at the mobile app. So when you log in, this is an example of what it would look like. You log in, you're able to enter your username, your password, enter patient information, and then begin visualizing the cervix. You have the ability to capture video on it. You can see on the bottom right-hand corner, you can capture video. You have a green filter, and you're also able to annotate images. Everything that's captured on the app and on the portal are secure and stay within a HIPAA compliant cloud. So it's the highest levels of security from non-US standards. And then of course you can use all these images for remote consultation and for documentation. So let's go to the next one. Excellent. So when you begin seeing a patient, you're able to capture all the different details. We have several different fields, all customizable depending on what a hospital network wants. You capture information such as a patient ID, their name, age, phone number, number of children, HPV status, Pap smear, when they had their most recent Pap, and so on and so forth. After you capture that, then you visualize the patient, and then you also have the ability to record the patient diagnosis at the point of care. And we have different trees that walk you through whether, normal or abnormal. If it's abnormal, what is it? And then what's the next stage? Is it a referral? Is it a treatment? And if so, what kind? And all of this is captured with the click of a few buttons in order to create a complete patient record digitally and automatically. Here you get a better sense of what we mean by smart visualization. So many standard colposcopes will have external filters, and very few of them allow you to annotate the images directly. What we have is everything on your mobile phone enables automatic video capture, image capture, green filter, and then annotations where you can annotate specific parts of the image with different information on whether it's a acetyl whitening change or if there's a bit of a cyst or an abnormality, and so on and so forth. Now, really, when you're looking at the clinical level, what we looked at previously is already far superior to what you have in a standard colposcope. But in addition to that, because we're using digital tools, we're really able to support administrators and program managers, making this a choice colposcope not only for private practices, but really for larger networks. And with these larger networks, what they're getting from this is the ability to connect all of the different colposcopes back to one cloud server from within their system. So in a hospital network, they connect those back using our cloud portal to be able to store those cases in one place, almost like an electronic medical record system, to be able to share those cases with people within the network for collaboration, for quality assurance, and then of course to generate different reports to tell you about the health of the program, how many screenings are taking place in the different sub-hospitals of a hospital network. Here's an example of what the portal looks like online. You can see you log in by going to portal.mobileodt.com and entering your username and password. And what you see are your cases, statistics, and then there are 2 additional buttons for conversations and for QA. Right now we're looking at a case that has a conversation around it. So in the case, you're able to see any patient information that's been captured, the images, the annotations, and then of course a conversation. So for example, in this case, Esther Arthur had a question for her colleague Julie, and she sent her the question using the secure collaboration feature on our portal, and Judy received an email notifying her that she should go online into the portal to check the notification. And now they're able to have a conversation back and forth in a very secure manner, looking at this specific case with the images and the annotation and the patient information. So it's a really excellent tool for larger hospital networks and for teaching programs. Here's a tab of what our quality assurance feature looks like online. So what you have here is the ability for a supervisor and more expert gynecologists to be able to work with a number of different newer gynecologists, medical residents, newly trained colposcopists, to be able to provide quality assurance to the hospital network. So for example, this supervisor is named Jennifer. Jennifer is receiving, you can see this is case 18 of 26, and she would be reviewing these cases, looking at the various images, looking at the annotations, and then looking at the provider's decision. Provider said it was normal. In this case, Jennifer will disagree and would note that. And all of this will generate a report at the end of her reviewing all the cases to be able to tell her which ones of the providers at which hospitals need further training or which women need to be seen again. So beyond conducting colposcopy at the point of care and capturing patient information and collaboration amongst different healthcare providers, you also have this added tool of quality assurance. In addition to that, on a programmatic level, many programs don't have a sense of the number of women that have been screened in total, and of them, how many were treated. So that's something that using a mobile tool enables programs to do. So especially for national programs or for larger hospital networks, they like to see this kind of information, and the EVA system enables us to do that. So this is an example from Nairobi, Kenya, where we were screened, where a group of hospital networks ran a screening camp and screened over 800 women, and were able to see that 85 of them were treated with cryotherapy. And this all happened over the course of 5 days, kind of big screening camp, and they were able to capture this information in real time because they were all using the EVA system. To give you another sense of what the reports look like, and again, in case I didn't say this, the quality assurance tool is an additional feature to what you get with the EVA system. And this is what some of the reports would look like. If you look on the right-hand side, it's a report generated based on the quality assurance feature and the agreement rates between the supervisor and the trainees. And on the left, you have what is part of the standard portal, which is the cases and the statistics. And the statistics will show us exactly where screenings are taking place, how many women have been screened and treated at each location, and then the breakdown of those diagnoses and treatment. Anything that's captured inside of our mobile app automatically uploads into the statistics page, and you're able to filter it based on diagnosis, on clinician, or on dates. So if you only wanted to, if you have a hospital network with 20 different hospitals and you only want to look at one specific one, you can filter it based on that and print a report based only on that one or on all of them. Now, one of the big challenges with colposcopy has really been around scalability and revenue generation. A big issue on many national levels is that there is an interest in doing cervical cancer screening, But scaling colposcopy is expensive because standard colposcopes are large, and also is very difficult because you're not able to monitor the quality. Now, the EVA system addresses both those challenges for scalability because it's small and low cost, and also because it has a quality assurance tool. So you're able to put a colposcope in the hands of lesser trained nurses who can go out and conduct colposcopy and be supervised by expert gynecologists. So specifically looking at national programs and government tenders, it's an excellent solution for cervical cancer screening on that kind of a level because of the scalability. Another issue that often comes up then is, okay, well, what about the cost? Well, not only there's always a cost involved, obviously, in purchasing new technology and in implementing new programs, but with the EVA system, you also have the ability to really increase the clinical practice. So a practice that previously may not have been able to conduct colposcopy due to limitations of the size or cost or ease of use of a traditional colposcope is now able to conduct colposcopy using the EVA system, to do so at scale, and then increase their revenue by providing more services, which has also been a really nice selling point for hospital networks that want to provide more services. And this is a way for them to justify doing so with the EVA system. So just to sum up, we've been using the EVA system in over 20 countries around the world, really focusing on low resource settings, including low resource settings in the US and in Europe, where there are not necessarily expert gynecologists everywhere, but where you have nurses who can be trained on colposcopy, use the colposcope, and then send that information using our mHealth tool to experts anywhere in the world. You can see that we had programs across the globe. The application is available in Spanish, French, Amharic, and English, and the portal is available also in various languages. And generally, we've been working with some really key partners around the world, and are really very excited to expand the use of the EVA system with you guys.
Thank you very much, Yael. That was very informative, and I think we have a few questions that have come in. So I think what we'll do is just keep the slide up here again for anyone that has not asked a question. There are two ways to do that. You can either type in your question to the questions section, and you can do that anonymously if you prefer, or you can click on that hand icon or picture for those of you that are not as worried about being exposed for who's asking the question, and you can ask that question directly to Yael. So those are the two ways, and if you have any questions, keep them coming. The first few we have is a question about the type of mobile phone that can be used. You had mentioned the mobile phone, but what types of operating systems are going to work with that?
Excellent. So we work with Android phones because they're available. They're very easily available internationally and are more affordable and have excellent cameras as well. So it's all Android based. We specifically recommend the Samsung J5 series and the Motorola G3.
Okay. And another follow-up question is, does the phone come with the machine, or is it just a separate purchase?
So for our distributors, we recommend that they purchase the phones from a local provider. Generally, we have a lot of connections with Samsung providers in various countries, and we can connect them. If not, then they can speak to someone locally in their country and get a good discount on a bulk order. So the technology does not come with a phone, but we do recommend selling it to the end user as a package.
Okay. And then for the phone, does it require a SIM connection or Wi-Fi connection? What would be required of it?
Okay, so the phone will still work like a standard phone, meaning if you're connected to Wi-Fi, everything will automatically upload to our portal. If you have no Wi-Fi connectivity, then a SIM card is a great way to ensure that all the information is constantly uploaded.
Okay. And then there's a few questions just about spare parts and consumables. One specifically about replacement batteries. Is that something that's available if the battery does wear out? And do you see much need for that in the use of the system?
Sure. So first of all, there are no consumables involved directly with the EVA system. It's used with standard colposcopy and with BIA. So the consumables that are generally used with that, the speculum, the gloves, are still being used, but the device itself is non-invasive. So it can be wiped down at the end of the day, but it never comes in contact with the patient. So there are no consumables with the EVA system. In terms of battery, it's a very powerful lithium battery, and it's rechargeable. So we have yet to have a battery that has died in the field. They are made to last about 10 years. So that's really not been an issue.
Okay. And then you mentioned that you can wipe it down. Is there any type of cleaning requirements and any type of process that's recommended?
Any kind of medical grade soap is okay, so you can take a wipe with medical grade soap and just wipe down the entire device. We recommend doing that at the end of a clinical day. Again, it doesn't come in contact with the patient, but we do recommend just cleaning it at the end of the day. And you can easily wipe down the whole device and the front of the phone.
Okay. And then there's a question here about, you had mentioned just the portal itself, analytics tools. Is there a system requirement for the computer that's connecting to that, or is there a certain speed that's required for connection?
So that's actually the beauty of it, is we've seen so many different Colposcopes that do try to work with software, and you need to install something and constantly update it. No, the beauty of this is it's just on a web browser. So if you're using, let's say, Google Chrome or Safari or Internet Explorer, you just go to portal.mobileodt.com, make sure you're using the latest version of your browser, and you're able to log on to the site.
Great. And then I have a couple inquiries here that people that just wanted to see it up close again, if possible, and if there's a way to turn it on. I'm not sure if the one you have there is charged, just to have a better sense for what that looks like up close.
Sure. So this is actually just fresh off the shelf demo, but here we go. I'll have a look at it, and let me introduce my colleague Freddie Tagger here as well.
Nice to meet you.
Who is actually our Vice President of Sales. So if any of you work with us, you'll be working with Freddie. Here you get to see the system up close. Sorry. You can see this is the charger for the light source. And you have the indicator over here to tell you how charged it is. You can see it. We've not charged this one in a while. You have the ability to mount it onto a stand using a universal port. So any kind of tripod or standard stand will work with this. This is the back of it. So you can see the phone is nicely built into it. So you're able to remove the phone if you want to insert it for the first time with a SIM card by simply using some Allen screws in there, and this pops out. The button for turning on and off the light is here. The charger for the phone is right there. And then you can see here's your lens, and you have a manual focus at the end. You can also focus by moving further and closer away from the patient the way you would with a standard colposcope. And that's the light again. So that's what you have here.
Great. I think satisfies most people's concerns about what it looks like. Thank you very much. And then there's just another quick question about, I think you might have mentioned it, but the amount of time that the battery charge lasts once it's fully charged.
Yes, it's 12 hours of continuous use. So that means if I turn on the light, it can stay on for 12 hours without being recharged. Now, in a clinical practice, you'll probably turn it on, leave it on for 30 seconds or a minute, turn it off for 30 minutes, and then turn it on for a couple minutes and turn it off. So it can last up to a week without being recharged.
Great, that's perfect. So I know some people may be asking questions. I've seen a few come in specifically about quotes, product inquiries, shipping, things like that. For those types of questions, you can send them directly to me. My information's up on the screen right now. It's just brian@eviaglobalhealth.com, or I'm always available on WhatsApp as well at +1 310 429 7968. So any questions you have specifically about making a purchase, about receiving a quote, shipping information, where we ship to, you can send those directly to me, and then I can streamline those over to Freddie and Yale as well. But I'll leave it just another couple minutes to see if anyone has other questions. Yep, okay, we have one more came in. Is it the same device for either phone type, Samsung or Motorola? And
it would be, oh, sorry.
And then the other follow-up to that would be, do we need to order the specific device ahead of time?
So yes, you would need to order the specific device ahead of time. Right now, the majority of orders are coming for the Samsung J5 because it's a great phone, available in most places and quite affordable. And yes, so the device would be the same and the brackets are slightly different. So the holder for the brackets on the phone are really what vary according to the size of the phone. So we do need to know ahead of time which phones will be purchased.
Okay, and how much advance notice do you need for that?
At least 30 days.
Okay. That is good. I do not see any other questions on the portal right now, so I think we can probably wrap that up. Again, if people have questions following the call, you can always send them directly to me with my information there on the page. There's also a wealth of information at the viaglobalhealth.com site. If you look for that link at the bottom of the page here for the Colposcope, we have all the information that you would need for specifications, regulatory approvals, any types of studies or background information there. You can find all of that there on the site. And again, you can reach out to me directly if you have any additional questions. But I do want to thank the team over at MobileODT and Yale for presenting. I know it's getting a little bit later in the day for you, but we appreciate your time and your focus.
Great. Thank you so much, Brian. It's been a pleasure.
Of course. And thank you to everyone else on the phone from all around the world. Thank you very much, and follow up if you have questions.